Sure. Thank you, Donna. Good afternoon and welcome to everyone. Thank you for joining this event today. My name is Dr. Renee Turchi, and I am a proud member of the Board of Directors of PCCY, and I'm a pediatrician by training. I'm currently the acting pediatrician in chief and chair of pediatrics at St. Christopher's Hospital for Children in Philadelphia. From our PCCY family to yours, I hope that this Zoom event finds you and all your family and friends healthy and safe, and that you're following the guidelines of our wise public officials and experts to slow the spread of COVID, staying calm, staying home, and staying well. It goes without saying that COVID really does not know any party, gender, orientation, age, and it really can affect children, adults, and anyone taking lives wantonly. And so again, we just at PCCY and as a pediatrician urge you to heed the guidance of our elected officials and infectious disease experts so that we can continue to save lives, protect folks, and get back to life as we knew it. So instead of being at our PCCY annual gala, we're here today Zooming, which has now become a verb. And we are glad to be here together. And today marks 40 years of fighting to meet the PCCY mission of helping children, especially those often living in poverty, abuse, with special health care needs, and those who our systems and parents at times may have failed to protect or nurtured. And in the 4 decades that PCCY has been in existence, we can point to small changes in policy that have had lasting impact on children. Some of them are as simple as making sure that a child on public assistance has corrective lenses, thinking about how often all of our children and any child that we may know has broken their glasses. Thanks to PCCY, parents and many children know that their child can have a second or third pair of glasses, which can make a huge impact in their life and in their time in school. And we can also count among some of the victories with PCCY, as well as many of the leaders in Philadelphia, the creation of the Pennsylvania Children's Health Insurance Program. Many of us know, as we know about. And many of the key contributors point to the pivotal role that PCCY played in creating the contours of the program and its enactment in 1991, and ensuring that it rolled out in a way that meant, it was meant to be in helping many children. And as a pediatrician, I can attest to the fact that in the last 40 years, the creation of what we all know as a CHIP is one of the most significant changes for the betterment in the lives of our children. And I really, having been the privilege of a board member of PCCY, I'm grateful that all they've done to continue to make sure that CHIP has not just been a reality in Pennsylvania, but across the nation. So now it is really my distinct pleasure and honor to introduce a hero in pediatrics, a friend and colleague, Dr. Rachel Levine, our Secretary of Health for the Commonwealth of Pennsylvania. She's also a professor of pediatrics and psychiatry at the Penn State College of Medicine. She's a fellow of the American Academy of Pediatrics, the Society for Adolescent Health and Medicine, the Academy for Eating Disorders, and the president-elect of ASTHO, which is the Association of State and Territorial Health Officials, just in this year. I've known Dr. Levine a number of years, and she truly is, has had a tremendous amount of forethought and foresight. And even prior to COVID, she has made one of the priorities of our Commonwealth disaster preparedness, maternal child health, and the opioid epidemic. And who knew, I imagine that she didn't even know she'd find herself here, saving the lives of many children and adults in the Commonwealth. So we truly are blessed to have her leading us through this crisis. And we have tons of supporters, including us here at PCCY, and many fans, and there's lots of social media of us supporting you out there, Dr. Levine, Secretary Levine, including things like if you post anything on Twitter, hashtag respect for Rachel. So it is, we know that you have limited time today, and many of us look forward to your 2 o'clock address. So without further ado, I want to turn this over to you and just say thank you for being here with us today.
Well, good afternoon. Thank you, Renee. Thanks so much. Renee has been a colleague and a friend for many years now and does absolutely fantastic work at St. Christopher's, in addition to her work as a board member of PCCY. So it is truly a pleasure to be here. Yeah, my time is tight. I'm pretty much scheduled about every half hour for the remainder of my life. So it's a challenge in addition to the press conferences. But I'm very pleased to be here, and I wanted to talk with you about organizations and PCCY and its supporters who are really always fighting to put the interests of children first. You know, I'm a pediatrician, and it's a special honor to kick off your 40th year, and it's been about 40 years that or so that you know, I started my medical career as well in medical school. So I have certainly watched PCCY. That is, aged myself. For many years. I've been impressed by all the different fantastic stands that you have taken, the changes that you've helped put in place, and really helping children in the Commonwealth. I can share just briefly in terms of the current public health crisis that we're in. Certainly, this is unprecedented in 102 years. As Renee said, I have always been as secretary in the last 3 years, had many priorities, including maternal child health, including the opioid crisis and the impact of the opioid crisis on mothers and children and those factors. But I always placed public health preparedness as one of the top 3 and said that we had to be prepared for something that could happen like a global pandemic. So here we are with a global pandemic of COVID-19. You know, we have a tremendous dedicated group of healthcare professionals. We're here at the Pennsylvania Emergency Management Building. You can see that right in back of me. I work with Randy Padfield, the director of PEMA, every day. We speak with the governor every day in the governor's office, and then all of our public health staff, and we really, everyone is working 24/7 to protect the public health. And also increase, you know, and protect the health of children. You know, this has been very hard on children, and, you know, less children than certainly seniors have been actually directly infected with COVID-19, at least that we know of. As we ramp up our testing, we'll learn more. But we do have, obviously, a serious complication now in children with the multi-system inflammatory syndrome in kids. That has been most prominent in New York City, although it has been seen in other countries. But there are patients with this inflammatory condition in Pennsylvania at our fantastic children's hospitals being taken care of. I'll be talking about that at one of the press conferences this week as we have more data coming in about those kids. And so it's certainly a challenge and a threat to the public health of everyone, including children. But it's not only a threat to their physical health. I mean, it's really a threat to their mental health as well. So, I mean, think about, you know, the anxiety and the stress of not being able to go to school and to see your teacher and to see your friends, and maybe not be able to visit your other family members, your grandparents and your extended family. And so, you know, for young children, it's just confusing. And for older children, they kind of get a sense of what's going on, and you want to be realistic for older kids and for adolescents. But you have to do that in the right way because otherwise they're going to get even more confused and scared and frightened. So, you know, for older kids, school year, you know, the traditional school year will be ending, and they'll be, if hopefully online, if they have a computer, and they can be online, you know, or if they have internet access. And there's so many challenges in urban areas, but also certainly suburban and rural areas as well. In terms of online school, especially in terms of how it was so abruptly had to transition to that. They can't socialize with their friends. They can't be on their teams. You know, one of our staff members, her daughters are in middle school and high school, and are always on the softball teams, but there was no softball this year. And so that whole thing is over. And one of the kids, I think, is a junior, so that whole junior year of softball is lost for her. And they've missed, for kids that are graduating, you know, they miss their prom. I mean, you can do it online, but it's not quite the same thing. And they're going to miss their graduation. And that's, it means a lot. So, it's hard for us to remember. I mean, my field is adolescent medicine, so trying to understand, adolescents and stuff. And so missing their senior year of the school play, or of their softball or baseball season, or lacrosse season, and then missing prom and graduation. And now what's going to happen with college next year? They might have been so thrilled to be in college next year in many different places, but will they have a college year next year? Is that going to be online college? That might be not what they kind of signed up for. So many different challenges. And then kids learn from what they see. You can, certainly teenagers, you can tell kids a lot, and it's important to do that, but kids learn what they see. And a lot of adults, many adults, most adults are anxious. They're confused. They're worried. Maybe they're depressed. And so kids pick up on that stress in the midst of something like a global pandemic. I think it is the media can be helpful, but the media is a double-edged sword. Both the media that they see on television, but especially what they read online and in social media. And so we know that I think we know, some adults know, some adults don't know, that everything they read online is not actually completely accurate, but what they see on Facebook is not necessarily accurate. But that's a challenge for adults. Imagine what it's like for kids and for teenagers, seeing very scary things on social media, online. I mean, old people like us are on Facebook, but they're on Twitter, they're on Instagram, they're on things I'm not sure I even know yet. So, or any of us know yet. So that can be really, really challenging. So social media and the internet can be really difficult. So, we want to make we want to make sure that we reassure our children. Is that we reassure our children about their family, about the future. I think it's important to be honest with kids. If you're not honest with kids, they pick that up right away. If you're not straight with kids, but it has to be depending upon the age and the developmental maturity of the young person. You have to message it correctly to their level about what's going on, and and reassure them that things are going to be okay. We don't know exactly when, we don't know how, but things will be okay. We need to look for and be observant for signs of stress in kids, signs of stress and anxiety and depression, and get them the help they need, which might be like this online, but to get them the help they need. I think the more that kids can have routines, the better. So routine time for bed, routine time getting up. That can be a lot of fun for adolescents. They love that. But kids do best with structure and guidelines and rules. There has to be sometimes flexibility. You have to have the rules appropriate for the age and development of the young person. But the worst thing you could do is have no guidelines and no rules. And so at home, I think parents with their own stresses about their jobs and finances can forget that, but kids need to go, even teenagers need to go to bed at a certain time. They need to get up at a certain time. They need to have regular meals, some type of activity or exercise. The weather's getting better now, so even if it's something out in their backyard, playing, so they really need, if they have a backyard, or playground might be tough. So some way to get some physical activity, make sure they get good nutrition, make sure that they're sleeping, and make sure that they have a steady routine can be really important for kids. And we particularly worry, and I know that I've had these discussions with Secretary Miller of the Department of Human Services in terms of children and youth services and those services for children, about children at risk of child abuse. They're not being seen as they're at home. Right. So, that's what we've been telling families to do. But if they're at home, then their teacher and their coach and their glee club director aren't seeing them, and might not, they might have picked up that a child had difficulties, or the principal or whatever, but now they're just at home. So that whole social protective network that we usually see for children, and all of us as mandated reporters, Well, they don't have that now. So that's a concern. And so really everybody needs to be observant. If you're going to the grocery store, to be observant if there are children there, if they go to the pharmacy or even online, so that people are observant about any physical or emotional signs of abuse. So, you know, I'm a positive and optimistic person. We are going to get through this. It's going to be challenging. It's going to be difficult, but we will get through this. And then, you know what? There's still going to be a lot of public health issues for children. They're going to be sitting there waiting for us. And now, actually, at the Department of Health, I mean, we do have staff working on other things. So, you know, not everybody. We have a lot of people dedicated towards COVID-19, but we do have staff directed towards the opioid crisis, and both the individuals that suffer from the disease of addiction to opioids or other substances, and their families. So we do have people dedicated to that in the Department of Health, in the Department of Human Services, in the Department of Drug and Alcohol Programs. So that has not stopped. It's not quite as prominent as we're used to seeing it, but it has not stopped. We do have staff still working on, for instance, an enormous public health issue of lead poisoning in children. And so we want to continue to work with you on things like lead poisoning. And working on this issue is just so important. We have proposed universal lead testing in Pennsylvania. Right now, really, it is only particularly kids with Medicaid and CHIP that get tested for lead poisoning as part of EPSDT. And other screening according to Medicaid and CHIP. But if you have commercial insurance, then I think it's much less likely you'll get tested. You know, your pediatrician should be asking the correct questions and do at least a sort of a screening questions, but doesn't always pick it up. So I know when I was in New York City, so I was a pediatrician through Mount Sinai and Lenox Hill in New York City. In the late 80s. I'm dating myself again. And so we had an interesting practice. So we saw a lot of kids from the area on Upper East Side. So we saw, you know, a lot of kids that had Medicaid, but we also saw a lot of kids from, you know, Park Avenue as well. And it was actually a very wealthy family with a very old, distinguished Park Avenue apartment, that had chipping lead paint. And those children had the highest lead levels I'd ever seen in my time in New York City. And they were a family of means in a Park Avenue apartment. So lead poisoning knows no socioeconomic status. It knows no insurance status. It doesn't care, just like COVID doesn't care. And so we need to make sure that we have universal lead screening, and we're asking the legislature for that. So we'll appreciate your support. We need to make sure that kids have health insurance. Right? So we have to make sure that kids have, every child, there's no excuse for any child not having health insurance. So whether it is commercial insurance, whether it is Medicaid or whether it's CHIP, we have to make sure that kids have insurance. I know that that's been an issue that you've been working on as well, working with the legislature and on the governor's office. And so that's just great. We have to make sure that no child is left behind in terms of health insurance, which would put them at significant physical and emotional risk. You know, I know an enormous program that I have been in favor of, and I know that Secretary Miller has been in favor of, is home visiting for mothers and babies. And so that program is so important. Secretary Miller has talked for a long time about how she has home visitors come to her home with a young baby. I'm not so young, and you know, my son's in law school, but so I don't need a home visitor right now. But she talks about how important that was, and so that's just great. WIC, participation in WIC. We have to improve our participation in WIC. It doesn't make any sense that we have had declining participation rates in WIC over the last number of years. I mean, this is not just a Pennsylvania thing. This is a national thing. That doesn't make any sense. There are some impediments that we don't quite understand for WIC. We need to work on that. So you all have had a fantastic track record for 40 years now, right? 40 years. And so you do a great job, an amazing job. Please read the 40 Ways PCCY has looked out for children. And you have a powerful advocate I am looking forward to working with you in terms of protecting children as a pediatrician and the Secretary of Health. As we work our way through COVID, we need to protect children. As we get past COVID, we need to protect children. And it's always been really what I have dedicated my life to, and then you all have dedicated your lives to as well. So thank you.
Thank you, Dr. Levine. I know you have to run, but I really want to take this opportunity to thank you so much for your leadership. I'm Estelle Richman, another proud member of the PCCY board. I also serve as vice president. And some of you know that I was the former Secretary of Human Services for the state. Dr. Levine, as a former Commonwealth Department head, I can only begin to imagine the complexity of decisions that you have to make every day during this crisis, particularly keeping folks focused on the health issues rather than on the politics. I've heard there are a few state lawmakers who think they can do the job. But you take every opportunity with your briefings to keep people focused on the real issues and try to make sure that those that think they can make better decisions, actually you try to help them understand. I can recall days when they thought the same of me, and I wore those days as a badge of honor because it reminded me that I was making the right decisions for people who are very vulnerable, for people who are sick, people who are forgotten, because indeed this virus, as many other issues that you've listed, doesn't know what your status is and whether or not you're documented. It doesn't know whether you're poor. It doesn't know whether your home is that of a rich person or a poor person. It just knows that you're vulnerable. And thank you so much for just all you've done and for all the people that you are looking out for. It's really been I'm one of those that tunes you in every day at 12 o'clock. So thank you for your messages and for reminding us of your daily reminders. I think all of that is just so important.
Well, thank you so much. Thank you.
As you've heard on this call, one of the biggest contributions to the lives of children was the role that we are playing and that we played over 40 years ago to get CHIP into law. Way back in 1989 and 1990, the Blue Cross plan of Western Pennsylvania inspired Fred DeBona at Independence Blue Cross to work with the city to launch a private partnership to give children in working class families access to health insurance. They turned to PCCY to broker that partnership. The storied history of CHIP is one we tell when we are together in person next year. And we'll talk about it a little bit more. But I don't want to have to wait until that moment to thank Independence Healthcare for paving the way for nearly 10 million children to be insured across America. And we don't want to wait to next year to thank Dan Hilferty for being such an amazing leader in this city and for his commitment to the health of our kids. I do have to say, Dan, your public service announcements that come on frequently have just been really helpful. And I think for all of us who have Blue Cross, who are part of this city, look forward to those messages and those reminders. And I just want to say thank you for that, because too often we don't get to say thank you to our leaders when they do something that's just out of the call. You and your staff have just made it very reassuring that this is a time that we will live through and will be better. I hope everyone will be there when we launch Dan next spring in person. But today I want to tell you that from his work to create a new health center in the heart of North Philadelphia with Project Home. Thank you, Dan. I happen to be on the Project Home board and part of the health committee. And your partnership with Project Home has just been great. In every turn, that every time we turn to a problem, you were there to be supportive. To your amazing support for the Philadelphia COVID Fund, and also to all of your efforts to combat opioid addiction. You know, while we would have hoped that maybe we would have seen that addiction go down, unfortunately in Philadelphia, it's not only staying the same, we're seeing some uptick. So thank you for your continued support around opiate addiction. And you are exactly the kind of inspired civic powerhouse that our city needs to clone. I wish we could figure out how to clone, folks. You would be first on that list. When Mayor Kenny and Donna asked Dan to help us to get undocumented children insured, he was there. And I think, as Dr. Levine mentioned, the virus, nor many other things, check in to find out whether you're insured or uninsured when you get sick. So making sure that all children, including undocumented children, are insured is important. When we asked independents to engage us in a fight against lead poisoning, they were there. And now they are a partner in making children's health access is not interrupted by this crisis. We treasure our partnership with independents, and I do treasure my friendship with Dan. We've known each other for a long time, and whenever the public system, whether I was at the state or here in the city, you have been there. So we're pleased that Dan Hilferty will be our Public Citizen of the Year in 2021. And so proud he's taken time today to share with us what's on his mind as we recover from this deadly virus and all of its implications. Dan?
Estelle, first of all, thank you very much for that kind introduction. And I'm so honored to look forward to being honored by PCCY in a few short months. I would say one of the silver linings of this pandemic is that we get to celebrate the 40th anniversary of PCCY for the whole year. And I look forward to supporting you and the rest of the board, Dr. Renee Turchi and Donna Cooper and your team, in making sure that people recognize the incredible work that PCCY continues to do, has done for 40 years for the young people, the children of our area. But Estelle, I have to start with you. You're right. We have known each other a long, long time. And frankly, whether it's the work that you do for Project Home, the work that you do here at PCCY, while you were a secretary in Harrisburg and really launched the Health Choices program, then followed by Donna and your great work to make sure that it was the preeminent Medicaid managed care program in the country, hands down. And we're fortunate to practice Medicaid managed care through many states throughout the country. And there are a lot of good ones, but there's only one Pennsylvania, and your leadership, your guidance. And a little while later, I'm going to reference the whole idea of behavioral health and its impact, not only on the entire community, but in particular, our young people. And the work that you did to create CBH in this region and replicate it throughout the Commonwealth really gave not only young people an opportunity, but everyone who are in underserved areas or impacted by health disparities to find a way to access the care they needed in a very professional, a very humane, and in a very effective way. So I'm not bashful in any way, shape, or form to say that Estelle Richman, you are one of my heroes, and this region, this Commonwealth, this country are just so fortunate to have you. Dr. Turchi, before I move on to this, just keep doing what you're doing at St. Chris. There is, with a lot of support from the provider community, clinicians like yourselves, the health insurance industry, there's going to be a resurgence, a rebuild of St. Chris in such a way that ensures that you will positively impact the lives of so many children who need you in this region and beyond. And I speak on behalf of the entire team at Independence Health Group, Independence Blue Cross, in saying we'll be there to help you do that. So congratulations. And Donna, to you and your team, it's just amazing the impact that PCCY has, but it's no surprise if you look at your history, your pedigree, very similar to Estelle's. And again, I'm honored to be part of this. And and really congratulate you for the terrific work that PCCY continues to do. I know that Secretary Levine had to get off to do other things, and I wish I could tell you that I've known her like I know many of you on this video conference. I knew of her, but it was during this COVID-19 crisis that I've had not just a glimpse, but a hands-on opportunity to understand what an incredible leader she is, working side by side with Governor Wolf. There's a level of confidence, there's a level of humility, and there's a level of not stopping to connect dots between counties, between clinicians and the state, between all of us that are involved in making sure that we not only learn from this pandemic, but that we come out of it as a healthy community of Pennsylvania citizens. And so I really applaud her for her effort. And I think what I'd like to focus on today is the spirit of what goes on at PCCY, the spirit of what is part of each of you who are board members, Donna, you and your team. And it's this, that we like to say, and it's not novel to independence, but it's something from working with you, working with Governor Rendell, working with Governor Casey, frankly, working with Governor Ridge and others, that the best healthcare provided in this country is a partnership between the public and private sector. Medicaid managed care, the CHIP program. First of all, without PCCY, the CHIP program would not be have the impact that it has on so many children across the Commonwealth. Dual eligibles, Medicare, Medicare Advantage, and now more recently, the way that whether they're state exchanges or federal exchanges, the exchanges have given people an opportunity who are teetering between being able to buy a commercial product or find themselves on Medicaid managed care. The truth of the matter is, it has worked, and it's been a private-public sector partnership that has made it so effective. So here's the story. It's this simple. Healthcare is a right, not a privilege. We all know that. The Affordable Care Act was a start. It should have been called the Accessible Care Act. Now we've got to address the affordability, and the goal, as it was then and should continue to be, that as close to 100% of the population of the United States of America should have access to quality health care, should be in a medical home, be it through Medicaid managed care, be it through the exchanges, be it through a great program like a CHIP program, whatever it is. And you think about it, at the peak of the Affordable Care Act, we were down to roughly 3% uninsured. Perfect? By far not a perfect system, but a start. And so now we have an opportunity, and I think it's been further illustrated the importance of having everyone in a medical home carrying some type of health insurance card, what we've gone through with this COVID-19 crisis. And we can go in many different directions. A number of them have been highlighted by Rachel and the work that she does, by our governor. We've been very proud to work with Mayor Kenny, with City Council, with state legislators, with our congressional delegation, to make sure that we're sharing the same information, collaborating across the region in a way that helps people understand how they can access care, where best to access it. And frankly, Estelle, I appreciate you referencing our work around informing people and hopefully calming them at a very stressful time. It's something that we take seriously and we will continue to do. I have to say, both of your former colleague, Governor Ed Rendell, calls me once every 2 weeks to tell me I have the wrong suit on in those commercials, and it's too light blue. It should be darker blue, and I accept that, but that's it. So the thing that
an interesting one to make comments on clothes.
I totally agree. I totally agree. But here's what I'd like to focus part of our attention right here, because I'm thinking about coming out of COVID-19. Would like to give you a couple of statistics. Some studies say that 1 out of 2 Americans will suffer some mental health, other behavioral health, or some types of substance disorder in their lifetime. 1 out of 2. The Blue Cross Blue Shield Association recently did a study under the Health of America program focusing on millennials. The numbers were startling. 6 of the top 10 disease states faced by millennials are mental, behavioral, or substance disorder in no particular order there, but they are the most prevalent. I suggest, we believe that the millennials have, at a certain level, destigmatized. They're willing to admit the things that they're addressing, where generations back to the baby boomer crowd that I'm part of, and then down through Gen Y, Gen Z, I think it's further exasperated. And whether it's the fact that there's constant use of technology or everything from a work that you have or some perceived weakness can be out in the public domain so freely. It's something that this COVID-19 crisis has really brought to the fore. And just a quick commercial here. We as an organization have been committed for some time to truly integrating, as by the way, you pioneers, whether it be at CBH or at Health Choices, work to integrate physical and behavioral care. Well, it's time to get beyond talking about it. It's time that insurance companies like ours, great institutions like Penn Medicine, Jefferson Health System, Children's Hospital, St. Christopher's Hospital, and many more begin to focus not only on the physical side of those we and they serve, but on the behavioral side. And so we have been committed to developing an array of products, an array of services that comprehensively address behavioral health needs. Currently, we contract with Magellan Health to provide some of our behavioral healthcare services. In the month of April, when the COVID was really coming to the fore, and I may have the stat off a little bit, but not by much, their call volume went up 24 times, meaning if they got 1 call, they would get 24 calls in that same period of time. It has since increased exponentially. I can't even give you the numbers that are associated there. We need to come out of COVID-19 working with organizations like PCCY, working with local government, working with county governments, working with state government, and yes, encouraging those that will fight for us in Congress to make sure that appropriate funding is there to really address the behavioral needs of all of our society, but in particular, our children. And it is first, breaking down the stigma. It is second, using proven techniques to make sure you work through clinicians on the physical side to make them understand and really appreciate that they can identify something that is going on in that individual child, that they may need some behavioral help. And then connecting between the physical and the behavioral side. And I see that as a place where PCCY, with the incredible accomplishments that you continue to have, can be at a key place to help organizations like the greatest health systems in the world are right here in Philadelphia, and organizations like Independence to truly figure out how we can connect the dots for our youth between not only taking care of that physical being, but that mental, spiritual, the soul of the individual, that you can't have a completely whole individual, a completely healthy individual, unless you take into account both their physical and their behavioral health needs. And I just think it's so exciting. It's so exciting that we, over the course of not only this year, but I pledge to you that if I can be a soldier with you in getting that message out, and our team will readily agree and be part of it, we would like to be there. Our Caring Foundation was involved from the beginning. We're moving now into what we call the Independence Blue Cross Foundation. We are committed to supporting services to working with the public sector to make sure that we not only educate, but that we educate clinicians, bring more into the behavioral health field so that we can truly meet the needs of our children. So I could go on and on about this. I got to save something to say when we get together later next spring, but I will leave you with this, that again, the best healthcare is true private public sector partnerships, and that we need to pay attention very closely and in the discussion at the congressional level around the future of not only behavioral health and how it fits in, but certainly where we are going next with the Affordable Care Act. This is not a political statement. This is simply a comment that something that works, as the Affordable Care Act has, again, should have been called the Accessible Care Act. We need to build on it. We need to improve on it. We need to put a value-based system in place where insurers, individual clinicians, providers as a whole are rewarded because of the outcomes and the way they compassionately work with each individual that they touch. So I am honored, Donna, I am honored to be with you today. I'm honored to be recognized in this way, representing Independence Health Group. Estelle, you referenced Fred DeBona, and Joe Frick followed in Fred's footsteps, and I'm just honored to serve that role for some period of time. And again, you have my pledge that we will continue to be a partner with you, PCCY, as you make the lives of millions of children better. Thank you very much. Have a wonderful day.
Thank you.
Thank you very much, Dan. We're so grateful you took the time to be with us today, and we're also indebted to the generosity of Secretary Levine. Hi, my name's John Summers. I have the honor of serving as PCCY's board president. As nice a picture this is not the meeting we wanted to have. We wanted to have a meeting with hundreds and hundreds of you live and together so we could be in the same room, not scatter the 250 or 300 odd folks who are taking their time out of the middle of their day to be looking at a screen for yet another 45 minutes or 1 hour. So while we are doing all the thank yous, and Dan and Rachel, my good colleagues, Estelle and Renee, you are highly deserving of them. I also want to thank all the people who are watching, and we're deeply appreciative of your commitment to be part of this. But I suspect nearly all of you have been longtime supporters of our organization, and we are deeply indebted to that. And frankly, we're in more need than ever, and we look forward to continuing to be with you and work with you. And so I want to thank you as well.
Hey, John, can I interrupt for 1 second? John, can I interrupt for 1 second?
Absolutely.
First of all, in making comments about everyone else, I failed to mention you. Thank you for your incredible leadership of PCCY, and I'd be remiss without just applauding you for the incredible work you do. Sorry to interrupt.
Oh, you're very kind. We have a whole year to get to know each other over the next year. I just want to pause for a moment and just, crises like the pandemic do a lot of different things. I want to focus for just a moment on three. One of them is, during times of crises, great leaders and leadership can rise up. And what I think you're seeing is that. You've heard it from Secretary Levine in the public sector. You're seeing that with Dan in the private sector. My good friend Renee is exhibiting that every day at St. Christopher's, as are our health professionals every day. And I could go on and on, but I think it's worth emphasizing that. In our own way, PCCY has also tried to provide some leadership. And one of the first things that we did when the COVID-19 crisis came was we didn't say, here's a laundry list of 30 or 40 things you need to do. We said, actually, there's one really good idea you need to do. And that is, at every place where important decisions are being made, have someone who's a child advocate, who's thinking about children, part of that process. A second thing that I think crises can do is focus the mind and think about what are the important things. There's a lot of noise. There's a lot of drinking from a water hydrant. There's the urgent trumping what is actually what's important. And what we as an organization have tried to do is focus on things. You've heard important issues that need attention, that are the role of mental health and behavioral health issues, the role of other kinds of vulnerabilities that folks have. And we as an organization are focusing on that in multiple ways, but one of them is an emphasis on the need for health insurance. Historically, that's an area where we feel we've made major contributions. There's a lot more work to be done, and you're going to hear more about that over the coming year. The third and final thing I want to say about what what crises teach is that the risks that are created by crises fall unequally. That's what's happened with COVID-19. A lot of the inequalities in the societies have been essentially pre-existing conditions for where the greatest negative impact has been of COVID-19. As we look and think about the vulnerability of populations in our region, it's easy to think of the implications and the vulnerabilities that come about from geographic locations, from relative wealth, income, other disadvantages. But one of the things that we've tried to focus on, and you've heard about this, is the plight of undocumented children. And among the most vulnerable populations are people who are feeling that when they look to the public sector, that's not a place they can go for comfort. That's a place of potential prosecution. And that is a significant problem, and is a significant deterrent. And it's one of a myriad of things that we organizationally are trying to do. Now, you've heard about the great work that our good friend Donna Cooper has been doing, and we do not have enough time in the day to fill that out. But she has colleagues who do tremendous work. One of them, Colleen McCauley, is with us today, and her work in the healthcare area, and in particular, trying to locate folks who are children who are not insured, and our efforts to try and identify those. Let me leave an ask for all of you out there, which is, this is not a one-way street with us telling you about all of our ideas. What we want to hear from you over time with your ideas and your suggestions. I'll just leave one, which is, if there are locations and areas and places we need to go and things we need to do so that more children get signed up for health insurance, call 1-800-Colleen McCauley. And you can find her email address on our website. So let me just sort of conclude with a big time thank you. We are in this together. We are a community. We are stronger being together and as a community. And let me not happy talk this also. I mean, the reality is this is really hard. This has been really difficult organizationally as a stressor on the organization. It's individually poses challenges and difficulties for all the folks at PCCY who work every day trying to do their good work. It's difficult for the board members to help out. I, again, want to shout out for Renee and others who are really on the front lines and the dangers and the threats that they face. And the reality is, all of you who are supporters every day are facing unparalleled threats and inconveniences. And it's easy to get lost in the hustle of the can do and the wanna do, to not also just sit back and say, this is really terrible. We're in this together with a lot of other people, and that's gonna be somewhat helpful. So let me leave it with that, with a big time thank you to everybody, and ask Donna, is there anything else to round out or end today's session?
Well, John, thank you for asking that, because if you can hear me on the panel group, wave your hands. Yeah, just want to make sure people noticed a rather alarming piece of information that would be a true to form PCCY reaction in today's paper, which is a notion that we should divert the money dedicated for pre-K to balance the city's budget. And it would not surprise you that I would take this opportunity to bring this to your attention and ask those of you who are on this call today, not only to help us identify children who are uninsured and to join us in our fight to get undocumented children health care, but every one of you should call your council members today. And if you have time, call all of the council members at large and tell them that's a really bad idea. Very simple. So I thank you for the opportunity to offer that, John, because I leapt out of my seat while eating oatmeal this morning while I read that and thought this is a terrific opportunity to make sure nobody missed that bad news. Thank you.
Okay, so well, with that, everybody, wonderful to share this time with you. Thank you very much, and have a safe and good day. Take care.
We'll see you in person. We'll see you in person soon, right?
Yes, yes.
This will all be more fun in person. Thank you.
Bye-bye, all.
Bye-bye.